Today we are with Dr. Piper Dankworth of
Hi.
La Costa Dental Excellence. Really excited. We're here at Amplified Studios up in Carlsbad. I have a lot to say about you, but I would love for you to do an introduction. If you don't mind, tell us a little bit about you and who you are.
I am Dr. Piper Dankworth. I am one of the owners and doctors at La Costa Dental Excellence. I am born and raised a Carlsbad local. I don't know. I think that's it.
That's awesome. That's kind of rare. Born and raised in San Diego and Carlsbad too.
Mm-hmm.
Tell us a little bit about that.
It was nice. I mean, the community is very active, very involved. So being here my whole life, I left for college and came back for dental school once I was finished. But it's nice still knowing so many people here.
Yeah. I obviously know a little bit more about you than most. So so I've been in dental for a long time, 20 years, and I have been following your practice for at least 10. I have been calling your parents. I've been calling you. You're just a brand that I always wanted to work with. And the reason is that you set a certain standard and you have a brand, and I can see that on everything that you do. Those are the type of people that I love working with because it actually makes my job easier. When you're really good at what you do, it makes it easy for us as marketers. So knowing that you're a family practice and that you guys have standards and a certain set of branding, I'd love to kind of hear about that. I'd love to hear, obviously, about being in the community, you being in Carlsbad, being able to work there. Like, there's so many things I want to ask you. But let's talk about what got you into dental and following your parents' footsteps.
I was always interested in health science. I, for a long time, thought I wanted to go the traditional medicine route, and I think a lot of that was just because I was in my parents' practice, but I wasn't really paying attention to what was going on in it. And so I had a very narrow understanding of what they did for a long time. And I thought I wanted to do traditional medicine, surgery, something of that kind of facet. And then I also realized I didn't really want a lifestyle that was attached to a hospital and being on call and not being in control of my own time. So that is what kind of steered me towards doing more research and understanding what my parents did in dentistry. And once I realized how much of the artistic side of myself and my personality could get put into dentistry in combination with the health and surgical side of things, I realized that it was kind of the perfect niche that I was looking for, and it doesn't hurt that I can control my own schedule.
Right? That's one of the things that I have been really drawn to the practice is the overall wellness. It's one thing yes, we want to look a certain way. We want to uphold that standard, or some people do. But we also want to feel good and function at our best. And I love that something that I heard that came out of your practice recently was that you don't guess. You're not guessing about treatment. And so, like, thinking about wellness and your initial path of, wanting to be MD, like, you said you had a narrow mindset about what your parents did. So tell me a little bit more how that's opened up for you now. Like, what do you see that you're able to treat?
So now so much of it is about systemic wellness, at least in our practice. It's not something that's common in dentistry still. It's a lot of practices and the philosophy around dentistry and kind of what patients expect is still very narrow. It's treating teeth. But the oral systemic connection, there's so much research that's been dumped into it to understand more about that connection, and that's really what sets our practice apart. And we've been doing this for, probably at least 7 to 10 years now, and it's not just about a pretty smile or getting your mouth healthy. It's about how that connects to the rest of your body and the impact that has on the rest of your body. And people are very surprised when they come in and we start spending time going over your medical history and what that means and how things are showing up in your mouth or vice versa that you were maybe unaware of. And there's a lot of things we can do in dentistry to help heal the body systemically. And I mean, most people are thrilled when they realize they can start doing less on the traditional medicine side of things, where they're realizing their diabetes are under more of a control, their hypertension is under better control. Their doctors are starting to be able to take them off some of these prescription meds that they've been taking their entire life, and they had no idea that so much of the impact of what's going on in their mouth can change what's going on in the rest of their body.
It has been just jaw-dropping to me to see, like, everything that you can find out is unreal. I mean, what what's a success story, or what's a scenario where you were really able to open a patient's mind and it's really changed things for them?
Yeah, we have a couple. I mean, one of the things that I shared recently on our social media platform is that a patient in our practice got to the point where he was very busy, like had a thriving career in his field, but it got to the point where he was having a hard time paying attention to meetings and having a hard time retaining things. And he got to the point where he was concerned and questioning, like, am I going to have to retire? Is that where I'm at? Like, I'm starting to get embarrassed about my cognitive function. Until he found our practice and we started getting his mouth healthy, and he started realizing the impact that had on his brain fog and mental health. And a lot of people don't realize those are tied. It's not just brain fog, but there's research now showing that what's going on in your mouth can directly correlate to risk with Alzheimer's and dementia. So there's a lot of preventative things we can be doing, especially in people that come from a genetic predisposition for diseases like this. We've seen patients that have gotten better diabetic control of their blood sugar from treating their mouth and getting their mouth healthy than they are on their hyperglycemic meds. So there's plenty of stories in our practice from patients that are really seeing big life impacts from what we can do just in our dental practice.
So it sounds like you're really taking the time with the patients, not only when you're meeting them and doing an exam, but also, the labs, the scans, everything that you do. And then as opposed to just a general blanket treatment or giving products for maybe a complaint they have, you're actually looking and saying, no, this is the cause, let's change it.
Yeah, there's a lot that we do in our practice, and I think one of the things that really sets us apart has more to do with the fact that we slow down and we take the time. We spend, in your new patient visit, almost 2 hours with our patients, just between the doctor and our hygienist, really understanding the foundation of what's going on and the starting point, because there's a lot we can do. And I think that's really what sets us apart with our patient experience is they come in and they feel listened to. They don't feel like they're repeating themselves 9,000 times. Like, that's one of my biggest pet peeves. I don't like walking into a medical office and you tell the nurse's assistant, and then you tell the nurse, and then you tell the doctor, and then you have to reiterate stuff to the front desk. And it's just one giant circle. And so our goal is cut all that out, slow down, listen, and really have a meaningful impact in a more efficient timeline. And for our patients, that's important. I mean, it doesn't matter if you have an insane career or just an insane family schedule. That one of the top things we hear with people is, I don't have the time. Right? So we're trying to be as impactful as we can with the time that we have with you. And so we use specific tools, metrics, tests, so that we aren't guessing. We can do a saliva test. We can diagnose what's going on in your mouth and treat you and get you healthier faster, because we know we're not just having this giant shotgun approach to, like, it might work, it might not, we'll see.
Right. That's, I find that in marketing that happens a lot too. It's a lot of guesswork. But there are systems, there's data there that tells you what you can do to improve. Mm-hmm. This fascinated me, that supposedly where the public heard you're supposed to go to the dentist twice a year for exam and cleanings was from an old, I want to say, heartburn commercial. Like, it's not even like truth. So I want to ask you, because it really is about time. If I'm preventing deterioration, if I'm preventing needing an implant or bone reduction, like, that's saving me a lot of time and money. Mm-hmm. So I'm all about prevention. So what do you think? How often should someone go to the dentist? Like, really?
It's a very tailored schedule. And that's what a lot of people don't understand is, for a long time, it was this thought process in dentistry. Oh, you go twice a year and get your teeth clean and have your x-rays and let's move on. But the reality of it is disease and prevention is not a one-size-fits-all. Yeah. You have your environmental factors. How are you taking care of your mouth? What are you eating? What's currently living in your mouth? In addition to, what are you genetically predisposed to? Yeah. So it's not just you can come in every 6 months. Some people are healthy enough and don't have the genetic predisposition that's great prevention for them, and it's sufficient. Other people we're seeing every 8 to 12 weeks. Yep. So it's not and that's what I find is also so different about our practice is this preventative and continuing care. We tailor it to the specific individual. It is
Right.
not just everyone gets put on the same schedule in our practice.
Yeah, that's for me personally. I have moved towards the fee-for-service model. I would rather pay and get the best treatment than pick and choose based on insurance and what that'll pay for.
Oh, absolutely. And I think that's one of the biggest misnomers in dentistry. And I can't remember the exact decade. It's probably dental insurances. Their fee schedules were structured for reimbursements for dentists, like sometime in the 60s or 70s.
Why
That ratio hasn't changed.
That's so crazy.
And so, but the insurance companies make the dentists out to be the bad guys.
Right.
They tell their patients, oh, well, this is plenty and this should cover that and your care should fall within these parameters. But the reality is our time has gone up. The just expenses for literally everything has gone up. And not to mention now what we know. I mean, part of the difference of going into some of these practices is you're not just paying for the quality of materials, you're paying for what your practitioner knows.
Right.
And so if you have the ability to walk into someone's practice who has the training, who's invested the time, there's a reason the price point is what it is.
Right.
And it's not for everyone. Not everyone even cares. And that's fine.
Yeah.
But for those who want to know more, practices like ours are around for it. And I could stand on a soapbox and talk about dental insurance for a long, long time. But they do. They handcuff practitioners and put us in a really uncomfortable position with our patients because we want them to be able to get the best care and have the best materials. But you can't do it anymore as a practitioner and
Right.
actually keep your door open. If you stay in network with some of these insurances, you are losing money treating patients.
Oh, absolutely. Well, then you look at, and I could go on too, because this whole thing has like been mind blowing to me. But I mean, if you look at the CEOs of those companies, they're doing just fine.
Delta Dental is supposed to be a
That's-
nonprofit.
I was just gonna say that. Yeah.
What are we doing over there, guys?
Wild. Yeah. So, I mean, for me, no matter what I do, I want the best, and that's why we work together. There's a certain standard. People know that about you. I think they've always known that about you, the way that you guys present yourself. So tell me a little bit about how you built that brand, how you set those standards, and how maybe that evolves over time.
Yeah, so I'm more so just upholding the standard. I can't take all the credit. I work with both my parents. They've been in this community for a long time. And from the jump, it's always been about exceptional care, exceptional results, exceptional dentistry. We all share the same philosophy in our practice of you don't want to have the work redone and I don't want to redo the work. And
Right.
Granted, things happen. But I want to approach it from a bigger picture and plan so that these results last a long time. They're predictable.
Right.
And in order to do that, there has to be a level of quality control that we put in our practice. And that's the expectations we set for ourselves. It's the expectations we set for our team. It's the expectations we set with our dental labs. So there's a level of mutual respect of it's good enough isn't what we're going for.
That was just music to my ears. Like there's a new standard, and that I totally.
Yeah, and perfect is unattainable in the world of dentistry. But excellence is.
Yes.
And that you'll hear my parents talk about was one of the biggest reasons as to why they chose our practice name is we might not be perfect, but we'll be as close as we can to it.
I love that. The pursuit of growth and excellence. Yeah. Okay. What do you think? I mean, you've been a part of the journey the whole way. I mean, what do you think La Costa Dental Excellence means to the community, and where do you guys see yourselves going next?
For us in the community, I think a large part of it is we're reliable. You know what to expect when you come in, whether it's because you've been a patient for a long time, whether it's because someone else has shared their experience with you or you read the reviews online. We're very intentional with our time and our interactions with our patients, and that speaks to, again, all the way through quality of care. But we're intentional with our team because we don't just want our business to be a reflection of what we've put in as doctors, but it's also the interaction you're going to have with every single one of our team members. And that's really important to us. And we're really proud to have the team members we have.
Yeah.
They care. They care about learning on their own, about growing on their own. They care about learning and growing as a team and in our environment. They care about educating our patients. They care about our patients as people.
Yeah.
We have multi-generational families in our practice, and our patients with our team are more than just a chart.
Right.
And they really get to know their life story and understand their history and what's going on, because again, part of treating them is understanding that, like, your mouth and your body go through changes and fluctuations depending on what's going on in your life.
Right.
Whether you're happy, you're stressed, you're depressed, there's plenty of things that affect the systemic side of you, and so it's important that we really understand who our patients are.
I can't say enough about that. Just the fact, the time that you spend to get to know them and their stories, I think also talks to, like we were talking about earlier, about the big picture, which we keep saying, but it's looking at the investment and what people are spending. You know, for example, I just went through the veneers process. I'm in temporaries right now. But that whole process is an investment. And some people, like, I knew I wanted this. I could have taken a smaller step and done something that wasn't porcelain or done an intermittent material, but that would prolong the treatment, the cost, like everything. So I love that you understand people's story and not only look at what's good for them right now, but the long term. So maybe could you tell us a little bit about, like, let's talk a little bit about cosmetics.
Sure. The process of cosmetics is very involved, and it's not just about slapping veneers in someone's face, right? Like, so many practitioners can give patients veneers, but it's a matter of doing it in a way where it's predictable and it's functional, and it actually makes the long-term care of their mouth and their health better. It's easier. And so you can't always do that just by saying, oh, well, I want some whiter teeth, or I want to change the shape, and here's 6 veneers. Some people, depending on their functional side, need more than that. Otherwise, it's frustrating. That's when we get patients in our office and they're at their wit's end because they've had every other veneer fall off or knock off, and they're constantly gluing them back on, or they got them done 3 years ago and now they're chipping. So there's more to the picture than just making the teeth a different shape or a different color.
Yeah.
And part of addressing the cosmetic side of things is also the functional side of things. And that functional side is going to get you into the position where your teeth don't break down, things don't chip, things don't pop off. It can increase your airway space. You can sleep better. It can get you out of pain if you have myofunctional pain. So there's a lot of other things behind what goes into planning a smile.
Right.
That not everyone has spent the time to fully understand or learn, that really make our outcomes different and predictable.
Right.
But that means sometimes, depending on your case, you can't do things in step-by-step increments.
Right.
And I feel like that's something that can kind of surprise people when they come in thinking, I'm going to get married in 3 months and I want veneers.
Yeah, let's do this.
Yeah. So sometimes it takes more planning than that to really get people to a predictable place where they're not going to run into trouble down the line.
Right.
Our goal is not to complicate your future. We want everything to stay healthy and last a long time.
But I think you keep saying too, like, you're partnering with your patients. I mean, you're in it for the long run. You want them to keep coming back. So of course, you're not going to do a one-time horrible deal and then never see them again.
No, and like I said, like, I don't want to spend my time fixing my work.
No.
Who wants to do that? So for us, it's all about, like, we want to plan ahead and not have to run into failures of things.
Yeah.
So what's the old saying? Like, if you fail to plan, you plan to fail.
Yeah.
Kind of thing.
Yeah.
So if you don't know where you're going and how you're going to get there and what the end result is, and reverse engineer that, there's really no guarantee on how that outcome is going to turn out.
Right. Right. No, I love that. What would you say? There's so many that I can think of. What would you say are some of the biggest dental misconceptions that people have now, or the biggest questions you get asked?
A lot of people are starting to hear the like dribbles of wellness dentistry.
Right.
But I think a lot of people still don't fully understand the true impact it has. Like, there are specific bacteria that they have found in, like, atheroscleromas, the things that form in heart vessels, plaques, blockages, that kind of stuff, that are specifically correlated. More than 80% is a specific periodontal pathogen that shows up in it.
Right.
Like, it's a causation that your risk for a heart attack and stroke directly go up depending on what's in your mouth. And it's like that with a lot of things. It's autoimmune disorders. It's cognitive disorders. It's GI disorders. It's miscarriages.
Wow.
Like, most women don't realize what's going on in your mouth and your partner's mouth.
Wow.
Bacteria is contractable, so conscientious about who you're kissing.
Yeah.
Like, so depending on what's growing in your mouth, some people we've had in our practice, and they didn't understand why they're on their third miscarriage, and they have really severe gum disease.
So tell me, how do they test? Are you drawing their blood? Like, tell me about that.
So with a lot of what's going on still, there's some things that have a cause effect with periodontal pathogens. Some things are correlations, meaning it's not, if you have this, it's not you will have this happen to you, but it's prevalent. They're finding the bacteria and these events are simultaneous. And it's really easy. It's not even for the needle phobic individual. It's a saliva test.
Oh, wow.
It takes a couple seconds, it's spit in a tube, it goes off to the lab, and it gets analyzed for over 500 different bacteria. It includes yeast and viruses.
Wow.
And so and this is one of the reasons why getting individuals healthy, putting them on the right recare to make sure they stay healthy once we get them there, is not a one-size-fits-all. Because some of these things are harder to treat than others. And some of these things require, sometimes it's just in-office treatment, sometimes it's systemic antibiotics or antifungals, sometimes there's nasal sprays we're using. So there's a larger picture once we really understand what's currently present in someone's mouth.
I will say, for me personally, I went through it, and it became a game for me as a patient. Like, I'm excited to go back next time and show, like, what I don't have anymore.
Yeah.
So it's like, it's a game to be healthy. It gets me involved, too.
Yeah, it's pretty amazing once patients are fully seeing the bigger picture of what's going on. It's one thing to have there's inflammation, which means something's bleeding. But, like, if you went home and brushed your hair and your scalp was bleeding, you're not just going to put your brush down and think, that's okay. Like, brushing your teeth or flossing and having blood show up isn't normal, and it's not healthy. It shouldn't. But so many people are so used to going to their dental office, and I call it supervised neglect. You get the brush and floss more shtick, and then they send you on your way instead of really helping the patient understand what's going on and how to fix it and how to prevent it.
You could have said that better. I mean, I keep saying an analogy of, like, patients are like, well, I floss and my gums bleed, so I don't floss anymore.
Oh, yes. Yeah, I'm like, no, you have to keep doing it. Eventually it'll stop, I promise. Yeah.
Oh my gosh. That is wild. And Maddie, how are we on time?
We're like 25 minutes.
Okay, perfect. Working with your parents. Let's hear some good, bad, and tell us some stuff.
The good, bad, the ugly. Well, I guess part can be seen as good, bad, or ugly, but we have to intentionally focus on not talking about work.
Right.
It doesn't matter if we're on a family vacation or just out to dinner or whatever it is, inevitably it circles back to something with the office. So we do have to be intentional with our time to not let it circle back to that. But we all have very different personalities and have taken on different roles in the practice, and that is a good thing, but also can be a challenge.
Right.
Like, when I first got out of dental school and started practicing with my parents, we had to have a sit down about, like, I am your child, but I am also, like, a doctor in your practice and a business partner with you, and so we are at the shift of our relationship of no longer treating me like your kid. But it's great. It's truly a blessing to be able to work with them, learn from them. they're such great mentors, and the impact it's had on me and my career has truly accelerated what I've been able to do at a much faster rate with a much deeper comprehension than I feel like a lot of other individuals would get because of the conversations I'm able to have with them at any hour of any day.
Yeah, no, that's huge. I worked in Yellow Pages long time ago. My mom worked there for 30 years. I was with her for 7, so I get it. I compartmentalized very well. I yelled out "Mom" once at work, and again.
Well, it's funny because for a while I was like so set on getting out of school, and I'm young, and patients are looking at you like, "Are you
right?
really a doctor?" And so for a while I was dead set on like, "No, we're calling you like
right.
Dr. Corrigan or Dr. Dankworth, and we're not calling each other like mom and dad." At this point, I don't care.
Yeah.
I introduce them as my parents, and I refer when I'm talking to people at work as my mom or my dad, or I don't know. So
I love that.
But I don't know, it felt more weird to try to be overly professional.
Right.
I guess that's just not our personalities. And I think that also speaks to like our interaction with our team and our patients as well. Like it's just more personalized practice.
Definitely. Have you worked on patients that have gotten to see you grow up?
Yes.
How is that? Tell me about it.
Yes. Very regularly, and more so probably at the start of when I was getting into the practice than now.
Yeah.
But oftentimes it would, lots of comments about, "I remember when you were
That
this
is
big
so
and
cute.
running around the office and my Disney outfits."
Yes.
But
Please tell me you were Ariel at some point. I was like for 6 years.
yeah, I think I circled through about every princess at some point in time. But it's fun to have them watch me grow up, or have them hear kind of secondhand from my parents about like undergrad and dental school, and now I'm getting to take care of them, and now it's me taking care of their kids. So I really enjoy that side of things. I think it's really special to be able to do that.
That really is. Well, you're at a point in life, so you just got married. Congratulations. Yay. Tell us what your plans are family-wise, and are you staying in La Costa and Carlsbad, and big pictures for the practice, or what are you planning?
Yeah, so my husband and I just got married about a month ago. And him and his brother own a business here locally in Carlsbad as well. We're here, we're in it for the long haul. I don't see us going anywhere anytime soon. But for us, I think we're nearing a transition point of my parents love what they do, so it's hard for them to want to start stepping back into retirement.
Mm-hmm.
But I think sometime in the near future we'll start to make arrangements for that. I think they're ready to do the fun things and not necessarily work 4 days a week still. So I think part of one of the transitions for me will be going through the process of finding either an associate or a dentist to partner with in our practice, but to keep growing and learning on the wellness side, it's incredibly fascinating.
I was going to say, that's just going to keep evolving, and it's like every day it's advancing.
It's accelerating quickly at this point, and I think that's the kind of forefront of dentistry. For a long time, traditional standard of care was fine, and things are advancing a lot in the world of cosmetics, but I think what really is going to change the name of the game is wellness dentistry and what people are starting to implement into their practice.
Right. I think being able to do everything in one place and have a partner in your journey in that is really what you're able to offer and what you have been offering, and now it's just becoming even more. Yeah. Okay. Anything else that you feel that you want to tell people or that you're asked? Anything like that?
Gosh. No, I don't think so. I mean, a lot of it is whether it's referrals that people find us through or Google searches, but it's the quality of care we provide is one of the main reasons people find us. But the other thing that I always encourage people to share is we specialize in working with high fear patients.
Interesting.
That's a big thing in our practice. We do sedation dentistry to help keep people comfortable. It's a conversation. There's no judgment. We're here to help meet people where they're at
Right.
talk to you about your goals, and help you achieve them.
Yeah.
So whether it's you just want a different experience and you see a dentist regularly, or whether it's been decades since you've seen a dentist, it's just a conversation with us, and we want to help. We're here to help. If that means we're doing your consultation in your car in the parking lot because you're so scared, that's what we're gonna do to help get you into the next step of being comfortable. So that's one of the things that I think we are really well known for, is that kind of care for our patients and our community. And that speaks to, I mean, one of our mentors, one of his things that he always says at the end of teaching is that a healthy person wants a million things, but a sick person only wants one.
Yeah.
And that has stuck with me like my whole career,
Yeah.
ever since I heard him say it. And that truly is what we're here to do, is help get people to the point where let's get you healthy, let's get you feeling better, and then let's help you go do other great things and not have to worry about what's going on in your mouth.
I love that. Well, Carlsbad La Costa San Diego is lucky to have you.
Thank you.
La Costa Dental Excellence, committed to excellence. The whole family. We have Dr. Piper Dankworth. We have Stephen and Kim as well, not here, but at the practice. I want to thank you for joining us, and thank you for letting us be a part of your journey. We love supporting brands that are committed to growth, and you're definitely one of them.
Thank you. Thanks for having me.
Thank you.